Hi everybody, welcome everybody to a practical approach to depression and sleep issues. I'm just going to make you aware of some housekeeping. So this meeting is being recorded and will be uploaded onto our YouTube channel. Please turn off your video if you're not comfortable with being recorded. If anyone wishes to discuss any sensitive issues during our Q&A and you don't want it to be uploaded to YouTube, please do just let us know. We can edit that section out. But please do ask any questions that you want to ask. This is a safe space. Everyone is muted. As you can appreciate, it's not possible to conduct a meeting when everybody's mic's on, but you will be able to post your questions via the chat facility, and you will have the opportunity to ask questions later on once Dr. Kuru has done her presentation. Please do not post any links or images on the chat or you will be removed from the meeting. Just a reminder that we are active on social media. Please follow us on ARCC Ltd on Twitter, Facebook, Instagram and YouTube. Thank you. So today we've got the practical approach to depression and sleep issues workshop with Dr. Kuru, and which is a part of our Here to Talk initiative by ARCC, which is to raise awareness of mental health issues in the Asian and Croydon communities. Our aim is to bring mental health topics to everyday conversations without having a stigma attached to it. This is so that we have an understanding of the signs to look out for the most common issues faced by our community and our loved ones. We can all become a champion for our families, friends, and our colleagues. So just taking you through the agenda. So we've got the introduction. I'm just going to introduce you to our speaker in a few minutes, and then we've got the presentation by Dr. Kuru, and then we're going to have a space for Q&A, and then we'll just close with some of our events and activities that's going on for ARCC. So Dr. Kuru, some of you may have already seen Dr. Kuru at one of our other meetings. So Dr. Kuru has been a GP in South London for 9 years and is currently a Deputy Medical Director for the Hurley Group and works in Kennington and Vauxhall. She's passionate about community health and uses her expertise in primary care to advocate for, support and empower people in the community to think about and care more for their health. So utilize Dr. Kuru's knowledge and her time. So I'm going to just pass you over to Dr. Kuru now. Thank you.
Good morning, everyone. I'm just going to see if I can share my screen and do that successfully. All right. So yeah, as Bina Kani said, the meeting is being recorded. However, if you do have kind of personal questions you want to ask or comments you want to share, you can do, and then like she said, they can edit that out later so it won't be shared with the wider public. So I kind of want you to use it as an opportunity to be free and comfortable. If there's a question you want to ask that you don't want your name attached to, I'm sure you can message someone privately so that it's anonymized, but we can still try to address it. Although it's a talk about kind of depression, I think you put sleep on the title as well. It's kind of going to focus more a little bit on mood, which is going to be where the practical approach comes in. And I guess the first question I have for everyone is, how are you and how are you really? Because I think what underpins our mood and when we talk about depression is really kind of dealing with the underlying issues, and that's what we're going to kind of go through now. So I can go to the next slide. So life is definitely full of ups and downs, and it's not going to talk so much about sleep today, because what I find about sleep is that people fall into kind of two big groups when they come and see us about sleep problems. This is very broad groups. So one group are people who just have had different types of sleep patterns all of their life. It's not because of anything weird, it's just how they are. Maybe they sleep late, they wake up early, maybe they only sleep for 4 or 5 hours. It's just inbuilt in them. And if you're coming to see a doctor about it, you're 20, 30, 50 years down the line, we're very unlikely to going to be able to change that, because sometimes it's just the way we're made. We're designed a little bit differently. So sometimes you can do all the things around sleep hygiene, making sure you're not watching TV late at night, not drinking stimulants like teas and coffees and things like that, it may not change how you sleep. The other big massive camp of people are people who have sleep problems because there's an underlying issue. And that's why it's not so much focus on how you manage sleep, because sleep is usually triggered by something. And common things that trigger problems of sleep can be drugs. So some people take certain drugs that affect their sleep, either things that they've been prescribed or things that people buy on the street or people buy on the internet. People buy really weird and wonderful drugs on the internet and they can affect your sleep. And often, which is what we're talking about today, it can be because of your mood. And with regards to your mood, it can be dependent on what is going on in your life. So that's why sleep really goes back to the basics. What is causing your problem? How are you? All right. So when we talk about life and when we talk about mental illness, we often think of these kind of two extremes. We think of serious mental illness and we think of people who have things like schizophrenia or suicidal ideation, who've got depression and it's so bad that you maybe need to be sectioned or you need to be on medication. And then you think of the other extreme, that you've got no mental health diagnosis at all. Well, you can have all of these problems and anything in between. Let's just go back a bit. But you can still have ups and downs. So I have a patient, for example, who's got schizophrenia. She hears voices, but things are very stable. She manages her voices very well. And when she's got a problem, that brings her up and down. So she came to see me about some issues that she had with her medication and some surgery she was due to have. She came to see me because she wasn't feeling very well about it. But when that was tackled, she went back to her baseline, which is hearing voices at home, but feeling well with it. And then you can have people on the other extreme, no mental health problems at all, but something hits them. They've got a debt, someone dies, and then they feel really low. They get through their grief and then they get back to what they may think is normal. So it's just to kind of really illustrate that you can have any diagnosis, you can have physical health problems, anything, but things, you will still have ups and downs in your life that we still need to deal with. So when we talk about depression, it's actually a leading cause of disability. And I'm just going to read out the World Health Organization definition of depression, because I think it's kind of quite nice and easy to understand. And it says, depression is a common mental disorder. It is characterized by persistent sadness, lack of interest. And I think as I say these, I just think that, does anything apply to you or someone that you know? Lack of interest or pleasure in previously rewarding or enjoyable activities. It can also disturb sleep and it can disturb appetite. So you might find some people when they're low, they either eat more or they don't eat at all, or they eat completely the wrong things or at the wrong times. It can cause tiredness and poor concentration. They're very common. Depression is a leading cause of disability. So that means it affects what you do day to day, your ability to go to work, your ability to get up and get dressed, brush your teeth, do your hair, put your makeup on. So sometimes if you have depression or low mood and you go and see your doctor, they ask you these questions and it may seem really odd, like, did I wash my hair? Have I done my makeup? It's kind of to see like, how much is this mood affecting your day to day? How much is it affecting how you function normally? Can you look after the kids? Can you take them to school on time? Are you always late for things? Can you remember someone's phone number when you used to remember it before? Are you forgetting appointments, not being around for important events, family events where people expect you to be? Can you just not be bothered? These are all the things that kind of signify how low your mood might be and how much it's affecting what you do. It says the causes of depression are complex. They're complex interactions between social, psychological, and biological factors. Life events such as childhood adversity, loss, unemployment contribute and may catalyze or make worse the development of depression. So, for example, there's a lot of people who are adults now, may have their own children, even grandchildren, and it's only now that they're really thinking about childhood abuse. They're hearing things in the news and they're thinking, actually, I was actually abused as a child. And it's now many decades down the line that they're experiencing the loss, the low mood, the anxiety, the worry. And it can be difficult to kind of share those experiences because you think, how is anyone going to understand that I'm feeling really bad because of something that happened years ago? It's just one of the examples. So here on this list of things, I've just put some, a lot of the things that people present with when they have low mood. Sometimes you may not know what's going on and you just think, I just don't feel right. So have you felt sad, anxious, tearful is one? So sometimes people suddenly feel that like even a really mild argument will suddenly make them feel really sad. Low, you're feeling unhappy, you get really angry. So again, in a similar vein, really simple events will get you really disproportionately angry. And the people that notice it are often the people that are closest to you. So then you get people asking you, are you okay? What's wrong with you? Or why did you behave like that? And then you get more angry because you can't vocalize or explain why you're feeling that way. Do you get upset? Are you suicidal? Just had enough? Unable to take any more of anything? Can't face another, could be face another day, can't face another conversation, can't face another red letter, can't face another medical diagnosis. So many things can fit into that. Do you feel worthless? Better off dead? Do you feel like a failure? Are you unmotivated? Are you hungry or you're not hungry? Are you bothered or you're not bothered? Have you got no pleasure in doing things? Do you feel hopeless? Do you feel guilt? Are you moving slower? So some people literally, they are moving at a slower pace than they normally would do. Do you feel agitated, so irritable? And do you have poor concentration? So people talk to you and having a normal conversation and you completely zone out. You've missed whole sections on what people have told you. And this can be really difficult if it's at really significant times of your life. So we get a lot of students who, for whatever reason, are going through something, and it can be when their dissertation is due in their final year, or when they've got important exams coming up. And sometimes we get asked to sign people off, or to provide medication or something like that, because they just can't concentrate enough to do what they know they should be doing really well. And the last point was that, do you feel tired? And that can really go in sync with poor sleep, because if you're not sleeping well, obviously you're going to be feel really tired and unrefreshed. So the solution really is, one, be honest with yourself. Doesn't matter how many people tell you you might feel low, angry, you seem strange, you're not behaving as you normally do. If you don't take on board a little bit of that and some self-reflection and think about, actually there might be something wrong, you don't have to diagnose yourself. This is not about you becoming a doctor or a psychologist or a therapist. It's just recognizing something is wrong. That really is the first point, because without that recognition, it doesn't matter what anyone tells you, you won't be able to progress forward. The next thing is to tell somebody. And there are so many people that you can tell, and we'll talk through that a little bit later. But it might just be anyone. It might be that you tell a friend, someone you trust. It might be someone at work. I know sometimes people find it easier to kind of be free with people that are not so close to them, but tell someone. And the next thing is pace yourself. So once you know something's wrong, you've told someone who might have directed you to where you might get help, or you've started on a journey with medication and treatment, don't expect really, really quick results. You have to pace yourself and be realistic. If you expect too much or expect it too quickly and it doesn't come to pass, you'll find that you just dip. So pace yourself, be kind to yourself. All right. So I'm just going to go through a few case studies, and these are kind of patients or people that I've met along my journey as a GP, just to kind of illustrate how people present when they have low mood and the things that really do contribute to it. So this first case is about an 80-year-old man, and I remember him. He was a Black Caribbean man, and he had just attended for his annual review. So he was just invited in. I can't remember what condition he had, but you should often get a physical health check every year, depending on what your problem is: blood pressure, high, underactive thyroid, heart failure, asthma. Every year at least you'll be invited in, or you should expect an annual review. And at these annual reviews, we tend to tag on questions about people's mood, or there's a section about kind of like your psychosocial well-being. So it can feel really strange for people to come in and they're coming in about their hypertension or their diabetes, and suddenly someone asks them about their mood. It's because we know that when you have either poor physical health or just have a range of medical problems, it can impact on how you feel. So we'd like to know. So if you go to a hospital appointment or something like that, and someone asks you how you feel, it may be strange to you, but we're asking it for a reason. So on this particular occasion, I asked this gentleman about his social history. I said, how are your finances? I said, do you have a pension or pension credit or benefits? To which he said, yes. And the next question really is, and a question that often I think we have to ask ourselves is, does your income cover your outgoings? And when I asked him that, he just started crying. And I didn't get any more detail about that conversation because he was just sobbing. And obviously that highlights that something is going on with his finances and there's a problem there. So he was very tearful, and the only thing I could do then was offer him something called a social prescriber. So in most of the practices across all of the boroughs in at least London, it's been a big push in London for it, you should have a social prescriber or some kind of scheme in the community that you can refer into. And the way I describe social prescribers are the way doctors prescribe medicine, social prescribers prescribe solutions for the community. They are absolutely brilliant and they are experts in everything in the community. They know how to contact the council. They know the form that you need to apply for the right housing. They know where the food banks are. They know where the carers support is. They know how to help you with debt management and refer you on to the appropriate debts management services. They know about the gambling services. They know how to help you with your PIP form. They know absolutely everything when it comes to everything social. And they're very good with having the time to spend with people to kind of pick through and see what the problems are. So I referred this gentleman on because obviously this is something that needs to be dealt with. And I think it's really important to know that if you have problems with your income and outgoings, your income and your outgoings, to figure out where those problems are. Sometimes it's with the energy, your energy bills, especially in this day and age. Like I've noticed my energy bills have almost doubled. And some people just can't afford it. That extra £20, extra £30, even more per month. And so energy providers are actually obligated to help you to pay your bills. So that doesn't mean they're going to pay it for you, but they help you to spread it out if you need to, or make it easier for you. So if you have a debt or a backlog, they should give you usually a 0% interest way of paying that back easily. But social prescribers, honestly, anything that you have in your in your home environment, I would say, in your living environment that's causing you issues, you don't have a bed, your lock on your door is broken, something like that, and you can't deal with it yourself. If you speak to a social prescriber, they'll let you know what is available in the community to help you. And I've seen them help a lot of people. That's the case. The next one, this lady, she's a 40-year-old female. This particular lady, she's very well educated, in a good job, but she called up very much in tune with how she feels. She already diagnosed with depression, but she just says, I wake up dreading each morning. I wake up and I just don't want the morning to come. She had a lot going on in her life. COVID at that time, we were just still in the middle of lockdowns and everything going around COVID. And just life had taken its toll on her. I think she was trying IVF, she'd been moving house. No problems with her husband at all. She lived with a very supportive partner, but just life was getting on top of her, and that was impacting on her mood, and she recognized that. She took an intentional overdose, and she was playing around with her medications to try and get the right dose. And I remember when I first spoke to her, I asked her if she needed time off work, because sometimes you just need a kind of break in everything just to rest and recover. And she said, no, I like to go to work. I'm really productive at work. It helps me keep focused and I really enjoy it. But fast forward like a few weeks down the line, she had started to change her meds. And literally every time I spoke to her, every week, she'd adjusted her medications herself, increasing this dose, changing this dose from the evening to the morning, being really erratic when she's normally quite focused. She was sounding more and more anxious. And she was saying that she couldn't do her work. She couldn't get through her working day. She couldn't think straight in the right way. And she was needing time off. And that actually was a trigger to say that actually your mental health is declining. We need a little bit more support than we are doing now in the GP. And for her, I needed to refer her back to the mental health team, which she accepted. So she was seen by the mental health team, and she had some intensive treatment and reviews of her medication, with a target aim of trying to get her back to a place where she can think straight, where she feels more comfortable, when she's not dreading work every morning, and when dreading each morning, and when she's able to get back to work. So it's just this, just to think about, if you do have existing depression, one of the things that we try to ask during reviews is, do you know what triggers you? Do you know what might make you decline? Do you recognize when you're declining? Do the people around you, if you have a support system, I know not everyone has, but if you have a support system, do they recognize when you're dipping? Are there signs that show that you need help? And can they tell you? If not, do they have your GP's number so that if they're really worried about you, they can seek help on your behalf? So these are the things that you need to think about. So even when everything's stable, it's really good to know and know what your signs of decline are so that you can get the help that you need. The next case is a gentleman who was 40 years old, and everything for him had just gone wrong. Again, it was kind of semi-secondary to COVID. He was an artist, and we know that during COVID, that industry really suffered a lot, because he used to do artwork and display them, but he couldn't display or do any displays or any exhibitions, so he couldn't get any income from that. Because he was self-employed, he wasn't entitled to any furlough or any kind of additional benefits. It was difficult for him. He'd just become a new dad, which he loved, but he was struggling with that new role in light of everything that was going on. On top of it, he developed a physical health problem. He had a problem with his eyes, so he couldn't then see to create new artist work when restrictions for COVID began to be lifted. So at the time when he thought he was going to make more work, make more money and have more work, he didn't have that opportunity anymore. So then he was now out of COVID, but now in a situation where his physical health was declining, and he was just feeling low. So he came in to see me, and we talked about these things. And again, I referred him to the social prescriber. I said, at least they can let you know about what's available, because again, many of the boroughs, they still do have access to food banks, and some boroughs will have vouchers to help you to get through your week. So I referred him on to them to see, let the social prescriber just discuss with you what the options are in the community. There might be something that can help you bridge the gap, or there might be a benefit that you're entitled to. And he did see her, and lo and behold, there was a budget, there was a grant available for people in his situation to help him. And he said it was just enough to help him get by. It was enough to help him buy his meals and do the things that he was worried about. The second thing was sorting out his physical health problems. It was really complex. It took a little bit of back and forth, but eventually we got him to the specialist that we needed him to get to. So all in all, he was really stressed out because of a number of factors. But actually, because we then had a plan to resolve them, he actually felt much better at the end of it. But you have to give things time. I remember speaking to him, and some weeks he felt better, some weeks he felt worse. So it took a few months before we were able to get him to a stable place. Again, it really started with him reaching out to us and letting us know that he had a concern and a problem. The next patient, it was, this is just about taking control of his pain. It was a 30-year-old male. I think this is more kind of like a good outcome story. He has known serious mental health. I think he had a history of psychosis, this gentleman. He'd had years of back pain, and I consulted with him while he was in what I'd call a good place. He'd actually been previously on codeine, and it was addictive, and he realized that it was addictive and making him unwell. So that's one thing to know, and kind of one of the things that we kind of parallels with sleep medication. Often if you have a sleep problem and you go to your GP and you just want medication, we may give it to you, but we're more likely to be reluctant to do so. Sleep tablets, sorry, my daughter's coming through. Sleep tablets can be really addictive. Sorry about that. They can be really addictive. And what happens is that after a time, they stop helping the sleep problem, and then you become addicted to them, and then you only want to keep on going back because you're addicted on them and not for any other reason at all. And the same thing can happen with drugs in the opiate family, like codeine and morphine. So we do use them very effectively for pain control, but it's really important to know when to come off. So after a while, you need to think about, okay, this pain that I'm having, I need to reduce how often or how frequently I'm taking the codeine. This is all with guidance from your GP, because there will be patients who need to be on this medication long term or who have been on it long term. So I'm not saying this applies to everyone, but this particular patient recognized that he was only taking codeine because he was addicted to it. I talked to him about his pain. He had a chronic pain problem. I think he had ankylosing spondylitis, and it's a problem that can cause pain and stiffness in the lower back in young people. And he said he decided that he was going to manage his pain differently. And he had looked at things like exercise and looked at other alternative methods and holistic ways of managing his pain. And I think that's a really good thing to note, that there's a lot of things that we can prescribe medication for and a lot of problems that need medication, but there are many things that actually can be really helped by alternative routes. And one alternative route is exercise. Exercise is a brilliant treatment for everything. I don't think there's anything that exercise is not good for. Exercise is brilliant for low mood. Exercise is brilliant for sleep as well. And we don't do enough of it. So just thinking about alternative things that you can do. Also having things that give you interest. So I do a lot of crafts. I make a lot of things at home. I'm always crafting, making things. For me, it's really relaxing. It helps me de-stress from my day. It gives me something else to focus on, something else to enjoy. So it's always really good to have something that you enjoy doing, that you get along with. I always often ask people when they have depression or low mood, like, is there something that you enjoy? And do you enjoy doing it? And if you think about the WHO definition, people lose an interest in doing things they enjoy. So it can be really something as a goal for you. Like if you've lost your interest, to think, okay, if I can get back to a place where I can enjoy doing what I used to do, then it can be kind of a guide to know how well I'm recovering. Anyway, this particular patient had not taken his mental health medications for 1 year, but he'd been well with it. So we usually recommend that if you're on mental health medication, if you want to come off it, and it's recommended that you do so, that you do it with the support of the right clinician. It can be a specialist nurse or a doctor, GP. But we do see many patients who are on medication who've stopped it for some reason, and we're seeing them 6 months down the line. If you're well with it, it is fine. You have a discussion with the person looking after you. And if you're well, we won't restart your medication if you don't need to. The aim in general practice and in secondary care is not to permanently have you on medication if you don't need to be on it. So it's really good, and it's really nice when people feel well without medication. We'll support that all the way. Now that he'd been off his codeine, he'd found out a way to manage his back pain, which was chronic. It hadn't gone away. He just had ways to manage it. And now that he felt well from a mental health perspective as well, he'd got himself at the age of around 30 into employment for the first time in years. And he felt really good about that. That was really proactive for him. So for this patient, although he had a serious mental health illness, although he had a physical health condition, he didn't need any onward referrals at all. I didn't need to add anything new to his treatment. I just provided him with support and said that he should just still check back in with us if he needed to. So just go to my next slide. So my final kind of case study, I think it's the final one, is a 12-year-old boy. So when we talk about mental health problems affect people of all ages, and we can't forget children. Children are really sensitive to the things that go on around them. So I can think of children who maybe in the middle of parents who are divorcing, for example, or children who are experiencing abuse. They're really sensitive to everything that's going on around, and sometimes it can be really challenging to know the language to use with kids, or ask them, or figure out, all those questions that are going on with them. Are they sad? Are they irritable? Are they angry? But often adults, when they're looking out for it, will know when their child is not behaving as you expect them to do, or a relative is not behaving as they expect them to do. And schools are really good at picking that up as well. So please, if a child seems not themselves, it's not something to be ignored. If you're not sure what to do, just book them in with a GP. You can just say, look, they're not behaving themselves. I'm not sure what to do. And then we'll take the next steps from there. So this particular boy, he was only 12 years old. He's from Bangladeshi origin. He was brought in by his sister. His parents didn't speak much English, which is why the sister, who spoke English more confidently, was bringing him in. He was getting into more and more trouble at school. He was getting put into regular detention. And in fact, on one of the days that I needed to see him, he was late for his appointment because he'd been put in detention. He was getting in trouble with his dad at home because he was getting in trouble at school. He felt the expectations at home were too great for him. He also mentioned, when I asked him, that he'd been bullied at school. And this was kind of reflected in the fact that I asked him about his friendships, and he said, I don't have the friends that I used to have. People think I'm weird. So as we talked about it, and I talked to him over a few consultations, there was a few things that I thought were important to note. One, when children are going through things at school, so even if you find that your child is being either being naughty or being labelled at naughty, we know that children can sometimes not do the things that we want them to do. But it's really important for them to have a family presence at school. And we know that families look very different at home. Some kids are looked after by their parents. Some kids are looked after by aunts and uncles, grandparents, foster parents. Whoever their guardians are, whoever's responsible, you need to be present at school. So that may be picking up the phone, having a discussion with the form tutor or head teacher, whoever's looking after their care, asking what the plan is. If they're getting into trouble, what is the issue? Is there an underlying issue? Do they need a different action plan? As I spoke to this child, it seemed that they may have something called ADHD, attention deficit hyperactivity disorder. So this is a combination of sometimes children withdrawing or being not very social, being more hyper, answering questions when they shouldn't, or answering the wrong questions, not interested in the school activities, or being able to focus for long enough to actually achieve. And I referred him on separately to the child mental health team for review. I also wrote to the school, because actually it can all be well and good putting a child into detention when they need it. But if a child has a mental health problem that hasn't been addressed, or some other issue going on, regular detentions are not going to solve the problem. So it's about getting to the heart of the issue. And I think the schools, just like any other service, are really hard pressed at the moment. But sometimes it can take a bit of pushing and a bit of more collaborative working between families and the schools to get things right. But schools, when they do get it right, they have brilliant support systems. They're usually linked with therapists. They're usually linked with social services, safeguarding. They usually have their own interventions, so teaching assistants, or different spaces in school where children can study, or have other support structures in place. So it's really important that parents, guardians understand the school system. If they don't understand it, they need to seek to understand it, because this is the environment where our children spend a lot of their day. So it's really important that it's as effective and efficient and safe and nurturing for them as possible. I also referred this child to social services, and social services I'm going to be labelled. I think often we need to put those thoughts aside. If a child is taken away from a family, it is really rare. But if a child is taken away from a family, it is usually because that's the safest thing for that child. But that is very, very rare. Social services are linked in with what are called early help services. And these are services that look at family units. They look at where families need support. They can provide links to additional help that child might need in school. They can create action plans. They can provide so much more than a family may be able to do on themselves. So I would say, don't be afraid of social services. And if you ever do have any concerns about what another team are going to do, whether it's a mental health team, always ask the person that's referring you, so that you have an understanding of why this is happening and what may happen if that referral doesn't take place. So kind of just to summarize in terms of what helps, just going back to the beginning, it's really just being honest with yourself. So after kind of we've been through all of those cases, I guess I ask you again, is like, how are you? And how are you really? Do you fall into any of those categories? Have you got financial problems? Is your child misbehaving at school? Are you a carer of someone? Or have you had new physical health problems that have changed what you can do and how you can make your income? Do you have chronic mental health illness and actually everything's stable, but you're dealing with the stigma? Are you out of work? Are you addicted to medication? So many things, so many normal things can happen to people. So it does take some courage to be honest with yourself, but that really is the starting point. Some problems can't be fixed, and we have to think about how we're going to deal with that. And that's a conversation that you have with your therapist, with your doctor. Dealing with chronic issues is really challenging and it's a long journey. But I think sometimes we have to be accepting of certain conditions and think about how we're going to deal with them instead, how we're going to deal with living with them instead. The next step, like I said, is ask for help. Who will you speak to? And I've got a few slides about so many options. But the important thing to know is what you need is unique. A lot of the questions that we get asked when we talk about mental health is, why does a doctor want to prescribe something as soon as I've been told I've got depression, or why do I have to have a tablet? It can feel like it's everyone, but it isn't. But it's important to know that if you do see a specialist about your mood, one of the options is often medication. It's not always medication. And it's about having knowledge, knowing what the options are and making the choice that's right for you. So for a lot of people, I tell them, look, this is an option. You can get NHS links with information about antidepressants or whatever the treatment might be. Have a think about it, have a read, but definitely always top of my list is therapy, talking therapy, or might be talking to your friends, counseling, because actually tablets help how you feel, but therapy starts to think about how you're going to deal with actually whatever you're going through. And thirdly, like I've mentioned before, is no unnecessary pressure. Resolving things, feeling well can often take longer than you think. Things aren't going to be resolved in a day. It's just impossible, even in a week. And sometimes if you think about how long you've been feeling that way, I usually tell people to use that as a guide. If you've been feeling unwell for 12 years, it may equally take you 12 years to kind of get to a place where you feel really, really, really comfortable. But along that way, it's a journey. And like we said at the beginning, you'll have ups and downs. But as long as you're on a road to recovery, I think you have to encourage yourself with that. So just the last two final slides of places where you can go. So again, if you feel low, or even if you can't put your finger on it, go and see your GP. And I say GP, I should say GP surgery, because nowadays we have such a wide range of clinical people that can see you. It may be a nurse, it may be a pharmacist, it may be a physio. There's so many different people within your GP surgery that you may be signposted to. So dependent on what your surgery makeup is, just see someone, start off somewhere, and then they'll start you on the journey to help you recover. Talking therapies, so in every borough, so we've got Croydon here, there's National Talking Therapy Service and it's free, and you can just refer yourself. You don't even need to see your GP for most problems. So you can, if you go online, if you just Google Croydon Talking Therapies, you can just refer yourself online. Someone will usually call you back, usually within around 3 weeks. You have to give some allowance when there's waiting times. They'll give you do a very brief assessment on the phone, figure out whether that's the right service for you. If you need counselling or if you need some specialist therapy, they'll let you know what that looks like and how long you have to wait, and then you'll get the therapy a bit further down the line. ACAS, just to say that this government, I know that we don't always like the government, but there's some good things that they have in place. And there's something called ACAS, and they are funded by the government, and it's a free service for you, and you can contact them for any workplace issues. So I always direct people to them if they've got workplace problems, because they will give you free advice and let you know what your rights are. And they are available Monday to Friday, I believe. If you go on their website, they can give you a number. The number's on there, if you can see. Gambling, that's another problem people have. They've gambled, they've remortgaged their home, they're in a situation where maybe they haven't told anyone and that's their problem, and they have to tell a partner that they're about to lose their home, or they've lost their job because they're gambling all day. You can self-refer for the NHS gambling service. It is free. National Debt Line. You have to be really careful online, because there's a lot of debt line services, along with all other services, that will say that they're official, but there will be a fee. And companies are entitled to charge a fee for their services if they wish, but there are so many free services available out there. The National Debt Line service is one of those. So you can contact them and they'll help you with plans to get out of debt, with supportive letters if needed, to give to, for example, like I said before, your energy suppliers, just to support you with a plan. Because if you're in debt, you need to deal with it. There's no point ignoring it. But they're brilliant. I've used them before. I say healthcare workers, just because there's so many healthcare workers you can choose from that can support you. And they, again, like I said, they look different at GP surgeries and in different boroughs, but so many people can help. I work for a service called the Beacon Project. I mean, we're more based in Lambeth and soon to be Greenwich and in Lewisham areas at the moment. But just to point out that there's lots of different community services that are available to you that provide free health support, just as ARCC are doing today. And I would just remind you to use them. So although you're having a talk today, there's no point in kind of coming away from the talk and saying, oh, I didn't remember any of that. I don't know what to do next. Nothing. You can just email someone, pick up a phone, go on social media to say, look, I had a talk with Dr. Kuru about my mood. I just want to know what I do next. That's a simple thing. Or join in and utilize the services that they provide to you. Another similar service is the Wellness Centre that is available in Croydon city centre as well. So again, just tap into it. So many free services available. I've got the gambling service again. Exercise, like I've mentioned before, there's lots of free exercise available. The NHS website has lots of free workout videos. And even if that's not your thing, there's exercises of all ranges on YouTube. So just do something. Go for a walk. There's amazing parks in the Croydon area, and they are free. So exercise is so important. So please exercise. Exercise does not mean you have to kind of carry your own weight 20 times a day, but it might be a brisk walk, something that breaks the sweat. Think about your religious background. So for many people, their churches are a support, their mosques, whatever your religious background is. So please think about speaking to your religious leaders about what you're going through. Sometimes what people are going through, it relates to their religion. So it's a really good place to go. Also education services, like I've mentioned before. When you're in education, most of the schools and universities and community colleges, they have services that you can tap into. So mental health services, services for debt, and counselling, but people don't often use them, and I'm really, really surprised. So if you've got a problem, this is not about telling everyone your business, but tell the right people and ask for the right referrals. The same for work as well. Most big organisations, and actually every organisation, should have access to occupational health. But if you're going through a health problem, and that includes your mental health, and it is affecting how you work, you can ask for an occupational health referral. And occupational health referral should really look at how you're feeling, if they need to make any adjustments for you to be able to work effectively, if you need time away from work, if you need to work less hours, shorter days, if your workload needs to be adjusted. In terms of how your GP can support with that, they can do a what they call is a maybe fit to work note. And then on that note, it has some tick boxes. So we suggest workplace adaptations or adjustment in working days and things like that. We can't prescribe it. We give this to you, you give it to your employer, and it's your employer has to make that assessment via the occupational health about what adjustments are required. But everyone can get support from their workplace. So I think that's it in a nutshell. So I think the main thing really is just like I've said, if you're not feeling yourself, ask for help. Thank you.
Thank you so much, Dr. Kuru. Could have gone on forever, I think, with that subject, isn't it? We've got a couple of questions on the chat bar. We are sort of running out of time. I think Ema's got her hand up, so if I just unmute Ema.
Thank you very much, Bina, and thank you very much, Dr. Osigbe. That was absolutely enlightening. I think it's really important that we kind of bring to the community these issues and case studies like you have, so that people can relate better to themselves. I've got a question about recently a lady I was speaking to, and she mentioned her mother. She said that her mother has been isolated at home just with the children for the past 20 years, really not got any family contact or not interested in family contact, very, very angry with the father. So if the children try and make contact with the father, it's kind of that disgruntled, don't like the father kind of situation, and the father no longer lives with them, so they've separated. And one of the things that the daughter said was that her mother seems to talk to someone as a confidant or just conversational that nobody else sees. So it's a person she speaks to, but she's not willing to engage with any services or speak to anyone in case she'll be put in a mental home. And that's her impression of services, basically, that the men in white will come. She's very normal. Well, I don't know the definition of normal, but she's quite sound when she's in front of other people, so you wouldn't detect there were these things going on. But she's got the habits like buying stuff she doesn't need, and just random behavior. It's really difficult to help someone who doesn't recognize that they need help. Can you advise at all?
Yeah, I think it's just exactly what you said, that therein lies the challenge. So often when we have patients like this, it takes the support of the family. So sometimes, although we prefer not to, you may ask to do a review under the guise of a general health review, for example. So you invite that person in to come in if they've got health problems for their annual health check. And then in that time, you can explore their mood and what they're going through. Sometimes, again, it depends on the relationship. The daughter may tell the mother that, look, I'm worried about this and I'm inviting the GP into this conversation. And they may agree to it, albeit grudgingly. So the only way around it is just to accept that it is a challenge, but just try different ways of trying to get that person to be seen. Sometimes it might be via community services. So if there are counselling services, I don't know if ARCC has any counselling services or anything like that. If community services have counselling services, then they can tap into that, because sometimes people find it easier to talk to people that look like them. So it's just trying different ways, but usually I see these people under the guise of a general health review and specifically ask about mood and things like that, and then get around things that way. Sometimes people just, it's okay to not always want help. I think that's what we have to it's just difficult for everyone else to accept. Sometimes people are just happy in the situation that they're in and they don't want everything, so we can't always help everyone, but we can definitely try different ways to reach out, but also just to reassure them and just say it is really difficult to be sectioned, really, really difficult. I worked in psychiatry for some time, and even when people had attempted suicide, they don't always get admitted. You need to be protected. You need to the reason for sectioning is to protect other people or protect yourself. So if you're not causing yourself harm or someone else, it's very, very unlikely that someone would be sectioned anyway.
Thank you. Bina, I've got another question in the chat. Do you mind if I just quickly ask that?
Yeah, that's fine.
Yeah. So the other question was around postnatal depression. How soon after giving birth can postnatal depression kick in, and how long can it last?
So it can happen straight after. So you have like baby blues, and we think about baby blues maybe lasting around 2 weeks. Sometimes you feel a bit low. It can be challenging bonding with baby, and then it kind of spontaneously recovers. anything that's lasting longer than that can potentially be postnatal depression, and it can last as long as turning into depression when it's outside of the postnatal natal period. Always seek help. The health visitors are absolutely brilliant because they will support you and baby up until you're 5 years old. And dependent on how deep the depression is, there are teams called the perinatal team. So the perinatal team are specialist mental health teams that support pregnant mums or soon after delivery with a range of mental health problems, especially if they're affecting their functioning. So seek help, and it can affect anyone at any time for any duration of time, but it's very well known and there's lots of support out there.
But could it affect someone many years after giving birth?
So it wouldn't
long periods.
So if it hasn't started after the birth period, so let's say it hasn't started within 6 weeks, we wouldn't necessarily call it postnatal depression. If you're getting depression many years after delivering, then it's just depression. But they are treated, it's usually the same treatments and they're managed in the same way, medication if needed, therapy if needed. So it can start afterwards, or if it started directly afterwards and lasted for a longer period than 6 weeks, 8 weeks, it can happen.
Thank you, Dr. Kuru.
No worries.
So I've only got a couple of minutes, so really quickly.
I can go on a bit longer if needed, it's okay.
Okay, so we've got a question from Lisa here. Answering questions when they shouldn't. Are you able to elaborate on this? How child may be deemed by school they are ADHD, please? You know, when you were talking about the children answering questions that are.
So I think it's kind of, we have to look more at the pattern. So there's some people who are they just like answering questions and you tell them don't do it and then they stop doing it. But there's some people who it will be a pattern and it will usually be over a period of time. So it won't be the first time they've done it, the second time they've done it. It will be a repeated action over different classes, regardless of who they're liaising with. And I think it's more of the pattern. So they won't be diagnosed on that basis. But if it's a repeated pattern, and especially if it's impacting on their education in terms of their grades and their concentration of others, it will be something that would need to be looked into. So like the child I saw, it's because it was a pattern that over a period of months, he'd just been declining. He wasn't doing well at school. He was answering questions before the questions was even finished, and then the answers were wrong. He wasn't focusing, he wasn't concentrating. And then there's some questionnaires that you can ask. And when we went through them, he was scoring quite highly. So I didn't even diagnose him with ADHD, it's just suspected, but I refer him to the right people, which is the community mental health team for kids, who will do the appropriate assessment. So it can be a sign.
Okay. Lisa, has that answered your question? Hopefully, while I go on.
No worries.
Oh, sorry, did you get that? Thank you. Yeah, that has answered.
Okay, Liz. Yeah, that's brilliant. Thank you. So one more question for you, Dr. Kuru. So is social prescriber something like Citizens Advice Bureau?
Yeah, I guess they can be a little bit like that, but I think maybe even more, because usually the social prescribers are plugged in with your GP surgery, so there's kind of like a two-way conversation. So if, for example, like my social prescriber has spoken to one of my patients and said, actually their mood is a bit low, doctor, can you please review? But they'll be, yeah, a bit like the Citizen Advice Bureau in terms of they'll know the ins and outs of everything that's happening in your community, but they'll be very plugged into what's going on in the local community, and especially around things like benefits and PIP. They're brilliant.
Okay, and are they actually based in the surgery?
So they'll be different for different places. I'll find out the details specifically for Croydon, but for example, where I work in Lambeth, they're based somewhere outside in the community. They come into the surgery when they need to, but they're accessible, usually by phone or email. But you have to be referred by your GP to the service.
GP, right? Okay.
But I know it won't really be so much Croydon, but I know the Crystal Palace Foundation, they have a social prescriber attached to them. So anyone who's kind of living on the border near the Crystal Palace end of kind of Croydon sides, they can access the Crystal Palace social prescriber, and they'll do a similar thing So assess your situation and see where they can help, whether it's refer for funding or provide healthy ideas like exercise and things like that. Yeah, so I'll find out those details and forward to you.
Okay, brilliant. Thank you. Hopefully that's answered Fasana's question there.
Yeah, I'll find out the exact ones for Croydon and let you know, Fasana.
Oh, that's brilliant. Thank you so much, Dr. Kuru, for an hour of enlightening information that we've just got. It's just so much stuff, you know, and like you say, it's all about seeking that support, isn't it? And in the right manner that's suitable for you, I guess, isn't it? Yeah. Because each one of us is very, very different.
Very, very different.
So that's brilliant. Got 3 minutes where I'm just going to quickly go through the events that's happening in ARCC. So we've got working in primary care, a session on Zoom, which is on the 1st of March between 6 and 7:30. So this is to learn more about the new types of jobs that are available, including care coordinators, health and wellbeing coaches, social prescribing linked workers, and trainee nurse associates. So this will give you a lot of information on how you can get trained up and what have you. So please do try and join us if you can. And also a new initiative by ARCC is the, can we just share this? Is it on there? Yep, the Sporting Memories Club, which is a new initiative by ARCC. So if there's anybody that would like to join this, please do let us know. If you go onto our website, there's lots and lots of information on there of how you can join as well. Yep, so I'm just sharing the screen there for us. Dance therapy, these are all like weekly sessions that we have, Pilates, all the stuff that Dr. Kuru has mentioned. Tuesday Talk is another brilliant place for everybody to meet up. Health champions, if you wanted to volunteer with us, you can do that. If you want to have a health champion to talk to, then that's also available for you. Expert Patients Program, that's another 6-week program that's available to all Croydon residents. And so the other thing that I wanted to let you know was about our free mental health first aid courses. For people in the community and organisations within Croydon, which ARCC is running for free. So our first one is scheduled for the 1st and 2nd of March, and I'm pleased to say that is fully booked. So if you wanted to join any of our sessions in the future, please do let me know, because we will be rolling these out in the future as well. So it's a really amazing course. So that's the end of today's session. So we'll be in touch with our next Here to Talk event soon. Until then, stay safe and look out for each other, like Dr. Kuru said. And thank you again for joining us, and have a brilliant day, everybody. Thank you.